Think Medicare covers all your vitamins at Walmart? Let's clear up the confusion in just 90 seconds. First things first, traditional Medicare, that's Part A and Part B, generally does not cover over-the-counter vitamins or supplements, so walking into Walmart expecting your basic multivitamin to be covered likely won't work. However, there's a key exception: Medicare Advantage plans, also known as Part C. These plans, offered by private insurance companies, may include benefits that cover certain health and wellness items. Now, here's the critical detail: even with Medicare Advantage, vitamin coverage is often limited and depends entirely on your specific plan. Some plans might offer a set allowance, say $25 or $50 per quarter, to spend on over-the-counter health products, including select vitamins. Moreover, coverage might be restricted to specific vitamins or supplements deemed medically necessary by your doctor. For instance, if you have a diagnosed vitamin deficiency, your doctor might prescribe a specific vitamin, and your plan might cover it. Think vitamin D for a deficiency, or prenatal vitamins during pregnancy. To find out exactly what your Medicare Advantage plan covers, you must review your plan summary of benefits. This document details covered services, limitations, and any requirements like prior authorization. You can usually find this information online or by calling your insurance provider directly. Another valuable step is to speak with a Walmart pharmacist. They can help you understand if a specific vitamin is covered under your plan, and they can also guide you on how to submit any necessary paperwork. Crucially, always consult with your doctor before starting any new vitamin or supplement regimen. They can assess your needs and determine if a specific vitamin is medically necessary for you. So, while getting vitamins directly covered by Medicare at Walmart can be tricky, understanding your plan's benefits and working with your doctor and pharmacist can help you navigate your options and potentially access covered benefits. Good luck.